So now I'm going to talk about cross-sex hormones, which I just call wrong sex hormones. Now, just puberty blockers real quick. When they studied some of these kids on puberty blockers, 100% of them decided to go on to take these cross-sex hormones. And wouldn't you, if you had all those problems I just described, and think, well, this must be my way out. But it's not a way out. It's just compounding the problem. This is showing female levels of testosterone. Now, females do have some smaller amount of testosterone. They primarily make estrogen, and vice versa. Males primarily make testosterone, but they have some small levels of estrogen. And the blue, from somewhere 10 to 50, is a normal level for the female adult testosterone. Certain conditions you may or may not have heard of, like polycystic ovarian syndrome, may have heard of, women can develop higher than normal testosterone levels and may get problems with acne, affects menstrual function, hair on the face and other places, and that's something that endocrinologists treat. Endocrine tumors of the adrenal gland can cause really high amounts of testosterone. That's what you see in red, up to 1,000. And what are they recommending for people who want to, quote unquote, transition sex? Recommending to get these levels to 300 to 1,000. That's some 10 to 40 times higher than what their bodies would ordinarily produce. Does that sound safe to you or like a good idea? It's not a good idea. These are super high doses of hormones, and what they'll do is they'll just lie, frankly. They replied to our letter and said, well, we're not giving high doses of hormones, we're just treating them based on their gender identity, which is a nothing. But that's how they're justifying this in the medical world. Next slide, please. What are side effects of taking these high-dose wrong sex hormones? For the male and female, they have increased risk of myocardial infarction, which means heart attack and death from cardiovascular disease. For the male, they've got 5 times increased risk of thromboembolism, which are blood clots, deadly blood clots. Other possibilities are gallstones, high triglycerides. Breast cancer risk goes up for males, and some males do get breast cancer, and the risk goes up. Gynecomastia is the abnormal production of breast tissue in the male, and that's going to happen. And of course, there's no FDA approval for this condition. For females, again, the increased risk of heart attack and death, increase in red blood cell count, that's what erythrocytosis is. Severe liver dysfunction is a possibility, high blood pressure, increased risk of different cancers like breast, uterine, ovarian cancer. And then, of course, they're going to get hirsutism, which is abnormal hair growth on the face, chest, or other areas, and changes or deepening of the voice. And the important thing about that is it's not like once these things happen, well, we'll just stop giving the medication, it will reverse itself. It doesn't. These are permanent changes. And, you know, I've been in contact with females who've done this and said, you know, I can't believe I did this, you know, to my voice or my face, or I have to get laser, or, you know, I can't afford the treatment for this. It's not reversible. I wish the doctors told me what was going to happen. Next slide, please. Yes. So what are other side effects of this treatment in terms of using high-dose testosterone on females, and what will happen psychologically? Well, they've shown, really from bodybuilders and people who are abusing testosterone, or other athletes, male and female, that there's increase in irritability, aggressiveness, grandiose beliefs, hyperactivity, reckless or dangerous behavior. Psychiatric symptoms become more common and severe as the dose increases, and we know these kids already have problems. Studies have shown that 23% of subjects using high doses of steroids meet psychological criteria for a major mood syndrome, like mania or depression, and 3 to 12% developed actual psychotic symptoms. Another thing that's on that list, if you might have seen I skipped over, is euphoria. Everyone probably knows what euphoria is. It's a really good feeling. Well, it is a drug. You're taking it in a high dose. For a time, you're going to feel great. This is the greatest thing in the world. Yes, it must be true. I'm taking testosterone, I feel great. My body must not really be female. I'm meant to take this medication. Or I'm taking this high dose of estrogen and everything's cool and smooth with me. This is fantastic. But we know what happens down the road 10 years later from that slide I showed you. I mean, through this work, I have a friend who was transgender male, took estrogen to be female, and his friend told him, you should stop taking this medication. It's gonna hurt you. And eventually he listened and he stopped, and he said, it was like snapping out of a haze, because the medication was making me feel good and smooth and cool. And then once I stopped, I realized what I was doing to my body. So there's a psychological effect to this that isn't talked about, and it's promoted as, oh, we're helping these kids. We've done this psychological study and see how much better they're doing. Well, yeah, you're taking high doses of drugs. What if you gave these kids high doses of THC, marijuana, or opiates, or something like that? They might feel really good too, but that's not ultimately going to help them. Next slide, please. Just to emphasize, there's no FDA approval for these uses that I've described, and this is straight from UCSF's website, unless they've taken it down at this point.